Questions. ICMR serological survey findings may have relevance for modifying vaccine policy. So, the new survey, which was conducted by the ICMR, it has found some new findings or new discoveries, which may have relevance for modifying vaccine policy. So, those new updates provided by the survey conducted by ICMR, they could hopefully bring some policies in the vaccination in the process of vaccination distribution. The results of the ICMR's third serological survey to ascertain the spread of COVID-19 show that nearly 1 in 5 Indians, about 270 million, may have been infected. So, the ICMR survey's shocking results show that the entire population of India is 270 million, and it says that in almost every case, 1 in 5 Indians was affected by the virus, and he is affected by the virus. And this survey, it was the third serological survey which was conducted by ICMR. The headline findings were the headline findings were published at a press conference, and it will be a while before granular details of the course of the infection, as was known till December, will be made public in a peer reviewed journal. So the headline findings were publicized at a press conference, and it will be while before granular details. So all the basic details and the most important details, like the headlines or the most attractive news. So all such news have been published by the ICMR survey at a press conference. But the remaining details and all the details, all of them will be published. All of them will be published in a journal. However, what is known so far is that compared to August, when data for the second serological survey was announced, there has been a threefold rise in the infections. So we don't know the exact details, but we know what's happening. So when we compare this third serological survey to the second serological survey, we find that the infections since then, they have raised 3 times. There has also been a fivefold rise of infection in those aged 10 to 17 years. So the rise of threefold times, it was just an average of all the humans. But when we specifically see for some aged people, for example, for the people who are in the ages between 10 to 17, they have shown a 5 percentage or a fivefold rise in the infections. The third edition also included a serological survey of doctors, nurses, and paramedical staff, revealing that nearly 25%, significantly above the national average, had been infected. And then other very unfortunate thing is that the doctors, nurses, and paramedical staff who have dedicated whole of all their time for treating the COVID-19 patients, now they became the victims of the COVID-19. 25% of the medical staff, like doctors, nurses, and paramedical staff were severely infected. Compared to reports of city-focused serology surveys in Delhi and mathematical modeling estimates, the ICMR survey results appear to be more conservative in estimating the true spread. So this ICMR survey, it's very honest. It's not like any other survey which was conducted by India, which was whose use was almost to promote India's achievements. But the ICMR survey, it was very honest, and it just showed the raw truth. Experts of various hues point to the declining trend in infections since September, and absence of multiple peaks in coronavirus cases, as a pointer to spread being far wider than speeding up herd immunity, a state when a significant proportion of the people in a locale have been infected, thereby retarding future spread. So experts of various hues point out. So many of the experts, or many of the journalists, they say that the main focus, or most of us, we should just we should just keep more importance. We should just keep more importance on how conservate on how the decline trend infection sits up. So most of the experts are saying that we should give more importance to the fact that since September, the rate of infections it has decreased, and we should not be seeing, or we should not be thinking about the negative thing, which was released in the ICMS third survey, that 5% increase in teenagers and so on. But it would be wrong to it would be wrong to derive comfort from this situation. So the author says that it would be wrong to derive comfort from this situation. So we are in a situation from which we need to get out. We really need to get out of this situation, because obviously any country doesn't want deaths, economic shortfall, or anything like that. No country would want that. And if you want to get out of the situation as soon as possible, first we should know what is happening. And if we keep on getting comfort from the false informations like this, they're not false, but they give us comfort, and they make us think that everything is all right, but actually everything is not all right. Many unfortunate things have been happening, and deriving comfort from such situation it would not be right. The ICMR emphasizes that results point out a significant number still potentially vulnerable, underscoring the need to be vaccinated and continuing with distancing and masking up too. So the ICMR says that we should start the vaccination process as soon as possible. And even if we start the vaccination program and vaccinated almost everyone, all of the people should still maintain social distance, and all of the people must wear masks, or the situation will be aggravated. Also, neither the survey nor any citywide survey has evaluated how long antibodies persist, and if certain virus mutant variants can overcome the protection by antibodies. So, also, I just said that ICMR survey was unlike any survey. It was unique. It proposed the unique and the raw data. But one thing that this survey and all the other surveys which were conducted in India, the one thing which they did not tell us is that even though if we get vaccinated, for how long will the effect of the antibodies will be left in our bodies, and can the new virus mutants of Japan and UK, can they overcome the immune system, can they overcome the immune boost provided by the vaccine, and can they still affect us? So no one knew. Both of this any of the surveys, they did not answer these questions. Given that vaccines are around the corner for the general public, and that no district has been immune from the virus, it is now no longer useful to know that 80% of India is still vulnerable. So vaccines will be soon coming, and most of the people in India are already affected, and it is no longer useful to know that 80% of India is still vulnerable. So 80% of still India is still vulnerable means only less amount of people got infected, but does not but that piece of information, it does not mean that less number of people died. Many people died due to the virus, but when compared to the total India's population, that's less percentage. So imagine that it was 20. So the deaths or the infections of the 20 percentage of India, it would make the rest 80% very vulnerable. So we should be very cautious at all times, and when vaccines come, we hope for the best. Rather, such surveys must shift focus to asking more granular questions. Should the rise in the spread among teenagers and children mean that they should be considered for vaccination earlier than scheduled? Should companies accelerate trials to test protection in children? Should the rise in rural India? The survey is designed in a way to sample more villages than urban pockets. Should the rise in rural India mean that they be given vaccines earlier? So the author is saying that rather such surveys must shift focus to more granular questions, to the more detailed questions, to the questions that most of the people really need answer for. For example, the questions like I said that for the people, or for the children, or for the teenagers between years of 10 and 17, there has been a 5% increase. So does that mean that so does that mean that the government it should prioritize giving vaccines to the children first and not the elderly? And the second question is that should the vaccination companies skip all their trials, or at least increase the speed of their trials so that people could receive vaccine earlier? And the last question is that India is developing rapidly. So is the rural area of India developing rapidly. So does that mean that the vaccine should be given to the children in the rural areas first? So these are some of the examples of granular questions. So if we get the answers for these questions from the conducted surveys, it would be a huge help. These and many more questions are no doubt already on the minds of specialist researchers, but alongside the vaccination drives, the ICMR and the government health facilities must coordinate with a broader spectrum of specialists to investigate questions that can be used to guide and modify vaccination policy. So, as I said, these are only some of the questions, and there are many more questions. And the author says that the author says that he should that all of these questions were already raised in the minds of many researchers and scientists, and they're still working on it. Now he says that the ICMR survey, which was conducted, it should include more experts and more specialists or more scientists in its survey, so that more of these granular questions can be answered. Thank you.